I love how Fox frames things, right? So they bring on a panel of doctors to talk about healthcare. You're going to be surprised to find out it turns out the doctors didn't like healthcare reform. The doctors that Fox News selected to come on and make these points, pretending as if they represent all the doctors in the world, and then they're going to make these wonderful points. Watch.
Right now, we know that 15,000 doctors, we're short of about 15,000 primary care doctors. By 2025, estimates are that 160,000 more doctors will be needed just to help handle the excess numbers of patients that will be included in this plan.
So there's a doctor shortage, Dr. Leahy.
There's a doctor shortage.
Breaking news, emergency.
Panic. And if we actually
call Gene Schmidt.
I love that argument, because if we actually cover all Americans or most Americans with this healthcare reform, we won't have enough doctors.
Right.
And you're going to run out of doctors for you, because we got to actually cover other Americans and the poor people. No, fight each other for the doctors.
Then why aren't they, by connection, saying that this bill is a job creator, right? Well, look at all,
look at all the doctors we can hire.
We're going to hire. We're going to hire
150,000 doctors, 3 office staff for each. We're already up to 750,000 people.
That's huge.
$1.5 million jobs.
Thank God
right
President
there.
Obama created all these jobs.
But in case that was too subtle, they're going to make it clear.
Right now, doctors are in a big rush to see patients. I mean, if you have the average practice, the physician doesn't spend as much time with the patient as he or she used to.
We've all experienced that. It's like in and out, in
Absolutely.
and out.
Oh, wait a minute. Stop.
And patients don't like that. They want to take time with their physicians.
Stop, because you're in my house now, okay? So this guy is saying, we don't like it because doctors don't have enough time to spend with patients, and yet there hasn't been Obamacare yet. So Obamacare can't be the cause of that. What is the cause of that? Insurance companies saying, I will only pay you $55 for this visit, so to meet your overhead, you have to see 5 patients an hour. He's making the argument against his very point. So this is the kind of, insurance, and later they say, well, we don't like other people making decisions for how we treat healthcare. What do you think insurance companies do a million times a day? They say, no, Cenk can't have that test because we won't pay for it. So it's a shell game. It's so phony.
By the way, if you don't have enough time, then it might not be wise to go on Fox News. Go treat some of your patients. Okay.
Right.
If you're running out there. Okay, but in all seriousness, the whole point of this is fight each other. Oh my God, there's a shortage of doctors, and what you got to do is, if you want your doctor to treat your kids, make sure the poor don't get health care coverage. If they're in middle class, make sure they don't get it.
Right.
There's a poor woman interviewed by the New York Times. I don't mean poor financially. I mean because she's misguided. And they ask her, hey, do you like the health care plan? She says, oh no, I hate it. They're going to mandate, they're going to make me pay, and I don't have the money, I don't have insurance, and I don't have the money, and I don't want to pay it. And it turns out she makes $37,500 a year, and she would actually get free health care insurance under President Obama's plan, one that she explains she desperately needs. So they've convinced her that she's actually with the working Americans and the affluent, et cetera, and that the poor would rob her, when in fact she would get free insurance that she desperately needs. Yeah. But and they're not done yet. Here's the doctors again pressing the same point.
But Dr. Siegel, I still don't understand. How does the health care law impact that?
Because the health care law adds many, many more regulations, guidelines, and observations about what's good care and what isn't, coming from committees that are making recommendations even as we sit here. This week it was about obesity. U.S. Preventive Services Task Force says we should be doing counseling for obesity. Every time one of those guidelines comes in, if it gets adopted by insurance, if it gets adopted by the Independent Medicare Advisory Board, which is part of Obamacare, if that happens, then doctors get told how to practice. We don't like getting told how to practice.
Word to America, do not go see Dr. Siegel for anything because he's a lousy diagnostician. We're not supposed to, doctors, would you mind, like if you have, a morbidly obese patient come in, like for example, Rush Limbaugh, mind saying to him, lay off the Pop-Tarts fatso while you're at it, because it's clinically proven that degrades his health and therefore costs the entire system more. No, doctors don't like being told what to do.
And the human body tells doctors what to do. That's what they're listening to. And if somebody's eating too many, if somebody's eating too many Pop-Tarts, it's not the government telling Siegel to tell him to stop eating Pop-Tarts. It's Siegel, the doctor, took a Hippocratic oath to say, hey, bud, lay off the Pop-Tarts.
Not necessarily, because we got a system where if Siegel's a cardiac surgeon, he's going to make money.
That's true.
Cleaning out the arteries of that obese patient. It's not in his financial interest.
I would have loved to have seen Siegel in medical school. They're like, all right, now this is how you make the decision. You're not going to tell me what to do, man. All right, I'm not going to make the decision that.
Give me the thread.
Okay. And my God, if he's doing all that paperwork, he doesn't have time for your kids.
Right.
You see what Obama. What's weird is that they
Your
found
fat kids.
Right. They found 3 doctors, and they all happen to despise the healthcare reform. Really weird, huh?
That's weird. And they're on the A
Must be
team.
what
They're on
doctors-
Fox Medical's A team. I don't understand it.
And Megyn Kelly's just asking innocent questions. Dr. Siegel, I don't understand. Explain it to me why it's so bad.